Hi everybody, welcome back to the Qualicare YouTube channel. My name is Trevor. This is Teresa Craig.
Hi.
She is the franchise owner for Qualicare Edmonton East, Fort Saskatchewan, and Sherwood Park. And today we're going to be talking to you about self-managed home care in Alberta. Here's a quick quote from Mehmet Murat Ilgan. "To make an elderly person happy is the noblest act a young person can ever do."
So true.
So true, right? And you know, it doesn't take a lot.
No, it doesn't.
You have a little kid come up and say hi to an elderly person, and just brightens up their whole day. Here's a quick stat for you guys. While providing appropriate care is the driving force behind home care, it also makes financial sense. Home care costs approximately $4,925 a year per client. An acute care bed costs an average of $1,500 a day. And this excludes ambulatory and emergency department costs. Now, that's from AHS, Receiving Home Care Enhancing Care in the Community report. So it's going to cost a lot less for someone to receive home care than it is to stay in a managed care facility from the Alberta government. Which is where they try and push people to go. Yeah, go to a nursing home, go to a nursing home. Why? Because it costs more and it provides more quote-unquote jobs when really they can get top-notch care from a person such as yourself, right? So tell us, you know, how you want to frame this discussion here. Tell us a little bit about home care in Alberta and your experience with that.
Awesome. Home care is a service, as everybody knows, and it's to help the caregivers and their loved one to stay safe and independent as long as possible in their own home. And of course, most people want to stay home, and they want to stay there forever. They don't ever want to go into a facility usually. Home care includes professional and personal care services, and I usually describe that as medical and non-medical services. Anyone living in Alberta with a valid healthcare card can receive home care services as long as their needs can be met safely within that home or in their place of, which is their place of residence. So AHS is more than willing to come in and provide those services for you. And that usually is for a minimum amount of time, anywhere from 15 minutes to an hour, up to 4 times a day they will come into your home. But there's also a couple of programs. We talked earlier about the invoicing program. And there's another one called Self-Managed Care, which is another program that every Albertan with that card is able to get if that's an option for them and if it's deemed necessary and appropriate. So self-managed care is an alternate method of service provision. It provides resources to directly pay and manage personal care and home care support services.
All right, so
in a nutshell.
So if you can tell us a little bit about what is a self-managed care agreement. Can you break that down for us?
Yes. So the self-managed care agreement is a legal contract between Alberta Health Services and the client or their legal representative, which could be like a power of attorney. And that could be a daughter or a son or a nephew or whatever that oversees these things for the client. The agreement governs the terms and conditions of the self-managed care funding. So the funding is provided to you by Alberta Health Services, and they put it into a separate account for that client who can then hire and manage the care that's provided to them.
Okay.
Yeah.
Awesome.
Yeah.
So what are some of the services that are provided through this self-managed care?
All right, so some of the services provided through the self-managed care program, they include personal care, so your activities of daily living, your basic needs, home support services, and respite care. Services are based on a home care assessment, so AHS will come into your home, assess you for that care that you're needed, and provide you with a time per week that you will be funded for. Personal care includes assistance with personal hygiene, dressing, toileting, mobilization and transferring, eating, oral care, and medication management. Those are some of those services. Home support services includes assistance with preparing meals, homemaking, and recreation activities. Respite care, as we talked about earlier in one of our other videos, includes day, evening, or night care to give unpaid caregivers, and that usually is family members, a break. So from the caregiving, so that they can attend to their needs, whether that's appointments, maybe they want to just take a little bit of a holiday, and so respite is there for you as well. Self-managed care funds cannot be used for any other purposes other than that. Professional services such as nursing, social work, or therapy services cannot be purchased with self-managed care, the funds that they provide you, but will be arranged by the home care case manager. So those areas are provided by AHS.
Okay. So what are the expectations of self-managed care recipients?
Well, it's quite an undertaking, but it's much more rewarding for the client and the family. You, your loved one, and or the legal representative who's in charge are responsible to recruit, interview, hire, train, supervise, and schedule those employees and direct the employees in the provision of care. You also should, at this point, develop a basic backup plan too when you do all of that, because in case your caregiver, your regular caregivers are sick, you would need somebody else to come in and take over for you.
Okay.
And so it's really important that someone who takes on this program is very organized. I would probably say that that's probably the number one thing they've got to be, is organized.
Yeah, if you're not organized, you don't know what's happening. I think anyone in a healthcare position, providing home care or anything, if you're not organized, you don't know what's going on.
Very true.
You want somebody who's organized in your house, taking care of your loved ones or taking care of yourself, so they know what days to come, what times to come, what things they're supposed to be doing for you on a regular basis, so you can keep on that schedule and maintain an excellent quality of life.
That's right.
Now, who can be hired under this self-managed care?
That's an excellent question. So you or your loved ones, or the legal representative, they are responsible to ensure that each employee is legally allowed to work in Canada. Number one, as per the agreement that you make with Alberta Health Services. Family members, friends, and informal caregivers are not allowed to be hired as paid caregivers. That is really important to understand, because safety is the number one goal here, and if you aren't qualified, you shouldn't be doing the job.
Exactly.
Yeah.
Now, what would Qualicare's role be in self-managed care?
Well, we would take over all of that. I would be overseeing who comes into the home, and I would be overseeing the schedule. We work with clients of all ages and their families to ensure that care we give is exactly what the client needs. So we would be working with the family and the client when we do this. And we also encourage that the family and the client are really involved in the care that we do provide. So they are part and parcel of everything we do.
Yeah, I think that's really important, because when it comes with AHS, like a lot of great people work for AHS.
Oh,
like, I rag on AHS a lot because anything government does is not as efficient as a private company can do.
Yeah.
Nobody can argue that fact, but there's a lot of good people there.
Absolutely.
Now with someone like yourself, being organized in making sure that the families are involved in the care and they understand what's going on, so that it's a cohesive agreement between you and the family and the person receiving care.
Yeah.
I think that is a unique identifier for Qualicare and what you guys bring to the table.
Yeah.
And I really like that, and I know that other people would appreciate that level of care as well.
Absolutely.
So what can someone do to get started with Qualicare, Teresa?
Well, number one, just give us a call. We can be contacted through our website. to qualicare.com/Edmonton-East. And our phone number is right there. And I will also tell you our phone number at 780-328-6655. Give us a call and let us know what you are going through. We want to hear that. And we'll come over to your house and give you an in-home consultation for free. Doesn't cost anything.
Fantastic. So you can get a consultation, a 360-degree care plan, custom made for you by Teresa.
Yeah.
And all you have to do is give her a call or check out the website, email. I don't know, there's probably other methods to get a hold of you, but use the ones that are out there. Take care, you guys. Thank you so much for watching this video, and we will have some more in the future.
Thanks so much.
Bye.